Yes, great. Excellent. So this is really just to wrap things up and to tell you a little bit more about our new Kleefstra Syndrome International Consortium. So just to wrap up, we've had an incredibly rich and engaging meeting. We've heard the latest clinical updates about this syndrome. We've heard about the recent advances in scientific research and about the pathway and the challenges in taking these discoveries to clinic. And importantly, we've heard from you, the community, about what your priorities are, which will guide us in our next steps. So where do we go from here? I wanted to tell you about the Kleefstra Syndrome International Consortium, which launches today. This consortium will pull together all of these pieces, clinical practice, research, and patient community at an international level. So as you all know, for rare genetic disease, international collaboration is essential. Working together at a global level allows us to leverage the power of numbers, to pool data, and to share resources and expertise. So this consortium is supported by the Boston Children's Hospital ICCTR. At present, we have 4 core networks, namely our colleagues here from Radboud UMC, Boston Children's Hospital, all of whom you've met, but also the Manchester Centre for Genomic Medicine, led by Siddharth Banka, and the Sydney Children's Hospital Network, led by Dr. Emma Palmer and Lisa Ewens. We'll continue to have discussions with colleagues around the world, including some colleagues in Hong Kong and within the US, including our partners at Johns Hopkins, about really establishing further partnerships. So we anticipate that this network is going to grow into a larger consortium. And of course, as part of this, we continue to work very much hand in hand with our friends at IDefine. So from a clinical perspective, we are establishing clinics, as we've discussed, specialised in the care of individuals with Kleefstra syndrome. We will share expertise and evaluate the evidence to determine the best practice guidelines for children and adults with KS. We plan to not only implement these guidelines within our own clinics, but to publish and disseminate them to the wider medical community so that every clinician who sees patients with Kleefstra syndrome can tap into this resource. From a research point of view, these clinics will serve as entry points for families who are willing and interested to participate in research studies. You've already heard about the Natural History Project aimed at adolescents and adults with KS, led and coordinated by the Radboud UMC team. And we plan to consider further collaborative projects as we move forward. And importantly, establishing these centres means that when the science leads us to an appropriate, safe clinical trial at the right time, we have sizable cohorts ready. In parallel, we'll continue to evaluate and contribute to the science and offer some guidance and expertise about potential therapies as they emerge to you, our partners at IDefine. So this brings us to the end of the official conference. On behalf of the Translational Neuroscience Centre, I would like to take this opportunity to thank our co-hosts, IDefine, Radboud UMC and Kleefstra.org for this incredible collaborative effort. I acknowledge the BCH ICCTR for supporting this meeting and for the amazing conference booklet. Thank you to everyone who worked so hard behind the scenes pulling this conference together. The effort and the global participation that has been harnessed by this event is a true testament to the power of your incredible community. But most of all, to every child, every adult, every family who's been touched by a rare genetic disease, we hear you, we see you, and we thank you for inspiring us to do the work we do. At this point, the recording of the meeting is going to stop. The speakers, the scientists, and medical attendees will sign off, and you can all really have a big sigh of relief. We'll leave you in Jeff's hands to regroup as a community, and we look forward to the next chapter. So thank you all.